Time and time again, he makes promises and then breaks those promises. In June, he told this House, I can undertake now to get all tests turned around in 24 hours by the end of June. They've had 6 months, Mr. Speaker, to get this right, and yet the Prime Minister still can't deliver on his promises. The Health Secretary said yesterday it would take weeks to sort the situation out. Well, Mr. Speaker, we don't have weeks. But the government's latest figures show that there were an average of 62,000 people tested per day, not 500,000. The Prime Minister has said that testing capacity is at 300,000, but the average is 62,000 a day. How does the Prime Minister explain this?
Mr. Speaker, we have delivered on, as I say, the most thoroughgoing testing regime anywhere in Europe, and we now have capacity. I think capacity has gone up from 200. The number of tests per day conducted, not capacity, has gone up from 210,000 last week to 240,000 this week. And just to repeat the statistics, we are now per 1,000 people, Mr. Speaker. This country is testing 2.54, Germany 1.88, Spain 1.91, and France 1.89. In other words, we are delivering exactly what we said we would do. What is happening, Mr. Speaker, is that the British people, quite understandably, are responding to that system with a huge surge in demand. And so it's very important that everybody follows the guidance about when they should be getting a test. The guidance sent out by Public Health England, which has been sent to schools, and from the NHS Test and Trace.
Angela Rayner.
Well, Mr. Speaker, once again, I see that the Prime Minister says it's somebody else's fault. It's the public that are using up the tests. These were the government's own figures and own targets, Mr. Speaker, that they failed on. And the next time a man with COVID symptoms drives from London to Durham, it'll probably be for the nearest COVID test.